At this time, I'd like to share a clip on the Charlotte Post Foundation so you can learn who we are and some of the initiatives that we have.
The general mission of the foundation is to put in programming that's going to help enhance and our community.
Black Lives Matter Charlotte, we kind of get some slack sometimes. People say we're not black enough because we're not out marching and protesting, demonstrating, and some folks say we're too black because we're saying Black Lives Matter instead of all lives matter.
We're about trying to help the community understand those issues that are impacting African Americans in a negative sense, and we try to bring in factual information to prove the point in terms of where we came from and how we got to where we are today.
So when we talk about changes, it has to be policy, it has to be systems, it has to be structures. That we are in the beginning of a movement that if we don't get it right this time, we may miss this opportunity for the next couple of decades, which would be scary. We got to get it right.
We want to have the community, the conversations across the entire Charlotte community, just to get input from all segments of our community, but more importantly, to hear from all segments of our community and just have that dialogue.
It's important for me and my church to be here tonight, to listen, to develop an understanding of obstacles to economic mobility that race presents in the city of Charlotte.
We also have to be honest about what these issues, where they come from, and where they come from going back to days of oppression and where that started. And really, people have to begin to be truthful with themselves.
But what I understand is that there's a history of people going through and producing reports and saying all these profound things and hitting the nail on the head and then doing nothing about it. Not just here in Charlotte, but in the nation.
Why are these conversations important, particularly in the Charlotte community?
Well, particularly in the Charlotte community, because we have avoided them, I think. I think we've been a little polite and not faced reality. Well, these parts of the community haven't.
These discussions are very necessary. It's what we do after the discussions, because since I've been here in Charlotte, that's all we've done is just talk. And now we are really in a need for a change. Instead of just talking, we need an action that goes behind this.
We do a top senior program where we are giving children scholarships, but they have to go through a judging process, and so we evaluate African American top seniors with a 3.25 grade point average or higher in the Charlotte-Mecklenburg system, and now even in the Wake County system. And those children are evaluated by a panel of judges, and two of the best top seniors out of that category are given scholarships.
What we are trying to achieve with our Charlotte Post After School Enrichment Program is to help our students understand the relationship between reading and achieving high reading scores, as well as improving our scores on our end of grade tests. So I would like for you to go ahead and annotate paragraph number 1 based upon what we have just read.
This program is about dropout, and what we've learned that if you don't catch kids at the time that they start taking the end of grade testing, and even before that, then those kids that are behind that early will never catch up.
When I see them just naturally begin doing the annotation without me having to do the extra fussing, in the beginning they were kind of pulling against it, but now they have it down packed. So that's really exciting for me.
All of our programming is driven with education, and hopefully at the end of the day, we are making a difference in the community that we care so much about.
So at this time, I would like to invite our president, Gerald Johnson of the Charlotte Post Foundation, to the podium. So at this time, I would like to invite our president, Gerald Johnson of the Charlotte Post Foundation, to the podium. So at this time, I would like to invite.
I heard you the first time.
You're going to turn on your phone.
I heard you the first time.
You're going to turn on your phone.
I don't have my phone on.
You're going to turn on your phone.
Nothing like technology, folks. We'll be with you in just a second as soon as I fix this. But anyway, nothing like technology, folks. We'll be with you in just a second as soon as I fix this. But anyway, nothing like technology, folks. We'll be with you in just a second as soon as I fix this. But anyway, okay. Hopefully we're done. Thank you all for attending tonight, and thank you for putting up with hearing me and people talking over me for the last umpteen minutes. But here's our program. You've heard about it, and that's what we do. And interestingly, everything that we do with this program requires us to raise money. Most of it comes from events as well as donations and grants. And at the end of the day, we spend a lot of time having to raise money because we have to spend a lot of money to carry out the programs that are dear and near to us. And tonight is one of those programs in community education. And we're looking forward to the presenters this evening on this very engaging and interesting topic that it demonstrates some of the issues that we're having in the community impacting African Americans. I'm not going to say too much more because you've heard me 3 or 4 times repeat myself unintentionally, but I will say we're going to put a link in the chat to do the donations that you want to donate. We don't charge to come to these events, but the events do cost, and we would welcome anything that you would do to donate to the cause. And I'm also going to ask Linda to put into the chat a correspondence I had with a Dr. Mixon Davis, who experienced this very same problem we're going to talk about tonight, and she wrote a book about it. And we're going to put that in the chat so that you can at least get an opportunity to hear her story. And we won't be able to get her on this evening because we're running a tight schedule, but interesting story for you to take a look at. And the only other thing I'm going to have to say is that all questions for this event have to go through Q&A on when you look, and they're going to talk about this a little later, but make sure that you understand that we don't take raised hands or putting questions in the chat. All questions have to come through the Q&A. With that said, I'm done. Thank you all again for coming out for this event this evening. And now
Thank you, Gerald, for that. Hi, it's me again, Linda Johnson. I'm here to go over some webinar etiquettes for this evening. As you mentioned, you did hear Gerald mention about the Q&A. So in front of you, you'll see a dialogue. You want to open it up on your computer, your mobile device there. The questions pertaining to our conversation will be held at the end. As mentioned earlier, you're going to put those in the Q&A. The chat is for our team to communicate with one another. We'll provide additional information about the resources from some of the speakers, the panelists you'll be hearing tonight. And so questions, again, we ask that you put them in the Q&A only. Thank you. And at this time, I'd like to turn it over to our moderator, Ryan Persinger.
Thank you so much, Linda. As Linda said, I serve on the Charlotte Post Foundation. So tonight, Dr. Connors will discuss problems associated with disparities in maternal health, while Mrs. Gammon will talk about solutions. And again, please make sure you put your questions in the Q&A and we will read them when both presenters have finished. Our first presenter is Dr. Connors. Dr. Connors is board certified in maternal and fetal medicine, as well as obstetrics and gynecology. She is chair of the Atrium Health Department and is a leader on the Atrium Health Women's Quality Committee. She was honored as a finalist for the Atrium Health Teal Acorn Award for Physician Leader of the Year. She is conducting a National Institutes of Health funded research initiative on maternal genetic markers of glycine metabolism. Dr. Connors is also doing grant-funded research with Wake Forest University on COVID-19 infections and their effects on the renin-angiotensin, I hope I said that correctly, system in mothers and babies. She has a special interest in addressing healthcare disparities. Dr. Connors received her medical degree at the University of Pennsylvania and completed residency at Christiana Care Health System. She completed a fellowship in maternal fetal medicine and received a Master of Business Administration degree at Wake Forest University. And at this time, I'll turn it over to Dr. Connors.
Thank you. I'm going to share my screen. You can see that okay?
Yes, we can.
Okay, well, thank you for inviting me tonight. I'm really excited to talk to you all. This is one of the things that I'm really interested in as a physician. As she mentioned, I am a maternal fetal medicine doctor, which means that I take care of high-risk pregnancies. So that can be high risk because of a mother issue, like underlying medical problems, or because of a baby issue, like a birth defect. And so, we spend a lot of time focusing on how we're providing care and making sure that we're providing equitable care. So I have just a couple of objectives. So I'll talk about healthcare disparities, particularly as it relates to Black women. So we know that there are also disparities with Native American women and Indigenous women in the country. But tonight I'm going to focus on Black maternal morbidity and mortality. And I'll give you a couple stories of some women who have died in childbirth, and then I'll frame out a few potential solutions, and then our next speaker will go into a little bit more detail. So as mentioned, I work at Atrium Health. I have worked there for the past 10 years. And this is our mission statement. And I like to show this because it's really important to me. And it is to elevate, to improve health, elevate hope, and advance healing for all. And the for all is really important because we want to make sure that when patients come through our doors, that they're being treated the same regardless of their background. So this is Crystal Anderson, and you might have read about her recently, but she was a cheerleader for the Kansas City Chiefs. She was 40 years old. She went into the hospital and was told that she had a fetal demise pretty, mid-pregnancy, around 21, 22 weeks. And then she subsequently developed sepsis, which is an infection that goes into your bloodstream, and she died not too long after that. The other thing that's interesting about her is that she was a software developer and actually had developed some software to help with detection of postpartum hemorrhage or extra bleeding after delivery to define risk factors for those women so they can be treated sooner. And so, of course, this is a tragedy. And how does this happen? How do you go in and it's bad enough to go in and have a stillbirth, but then for the mom to die as well is really sad. In the US, maternal mortality is considered to be a death within a year or during pregnancy of a woman. So during the pregnancy, at the delivery hospitalization, or within 1 year after pregnancy, that all counts into the statistics for the Centers for Disease Control when we're talking about mortality. And it's a ratio per 100,000 live births. So total is about 17 per 100,000 live births. However, that goes up to 37 per 100,000 for Black women. It goes down for both white and Hispanic women to about 15 and 12 respectively. The other thing to note is that for every death, thankfully, we don't see maternal deaths very often, but for every death, 100 women will suffer severe morbidity related to pregnancy, and these severe morbidities are considered near misses. This is US maternal mortality from 2005 to 2014, and it's given us a visual. On the left, this is for the total, and then on the right, you see Black women. You see how much darker the shades are. And in North Carolina and in the South, there tend to be more racial disparities. If you look out west, some of those are very light colored, but that's also because there's not a high population of Black women. This is just another way to show the same thing. This data goes through 2016, and you can see all the way back to 2007 is persistent that Black women have a higher mortality rate. And then the next highest, as I mentioned earlier, is American Indian or natives to the country. When we look at the World Health Organization at mortality rates per 100,000, you can see that the US is the developed country that has the worst mortality rate. And then if you look at Black women in particular, it skyrockets. So compared to our counterparts, our mortality overall is worse, and then Black women in particular is even worse. We know, as it was mentioned in the introduction, that Black women are 3 times as likely to die than white women during pregnancy or thereafter. And it's interesting that even Black moms who graduate from college still have a 60% increased risk of death compared to white or Hispanic women who didn't even graduate from high school. This is more recent data from 2018 to 2021. Again, you see for Black women is much higher than for white or Hispanic across the years. And then we can look at North Carolina. So this data is to 2015, and you can see that the risk for Black women is higher than for white women. However, it did come down from 2000 to 2015. And the reason why some of this data is a few years ago is because the data for maternal mortality always lags. It takes a few years to actually get the data. So it looks like we made some progress. However, in recent years, the rate is starting to go back up. I mentioned before about whether, you have a college degree as a Black woman, that really is not protective against mortality for Black women. And you can see in this graph that Black women, no matter what the education, they tend to have a higher mortality. So what are some causes of maternal death in the country? So the number one cause is a mental health condition. There's a rate of suicide that happens, especially in the postpartum period, and some of that is from not getting mental health services or care. And then things like hemorrhage. We see a lot of a lot of heart conditions. There are women who were born with heart conditions and they, because of treatment, are now living long enough to be able to reproduce, and they have children, and those pregnancies are very high risk. But then we also see women who have acquired heart disease, which comes from either having diabetes or being obese. Some women have heart attacks during pregnancy. And so these are the list in descending order of the frequency of what is causing people to die related to childbirth. So again, this is the same causes of death, the same. And what's interesting is that over half of them occurred more than 7 days after delivery. About 80% occurred in cities. And what's really striking is that 80% of them were considered to be preventable. And so that means that in the healthcare system, we really have to work to make sure that people are not dying from things that we could do something about. So when we talk about healthcare disparities, that's a difference in health and healthcare between groups that is linked with social, economic, or environmental disadvantages. And one thing that we are thinking about a lot is how implicit bias and systemic racism add up to end up with health disparities. So I think there's a lot of attention into social determinants of health and looking at food insecurity, housing insecurity, and those things all, of course, play a big role into the health of an individual. But I want to look a little bit at why that's the case. So this picture on the right, I actually have this picture in my office. And this is a picture, the guy on the right is a doctor. His name was James Marion Sims, and he is considered to be the father of gynecology. He became famous because he perfected certain surgeries, certain vaginal surgeries, and he did those on slave women without anesthesia. And there were some women who had multiple procedures. One in particular had 20 procedures to figure out how to repair what we call a rectovaginal fistula, which is an opening that occurs between the vagina and rectum after difficult childbirth. And so, in recent years, there's been, this outcry from the public to remove. They have statues of him in New York and South Carolina. There's a hospital in South Carolina. So it's deeply entrenched into the history of OBGYN. Part of how we think about Black women is based in history. And so we have the stereotypes that we, if you're older, grew up with, and the mammy, of course, and Aunt Jemima, and we all used to see her on the pancake box until they removed her maybe 2 years ago, 3 years ago, and replaced it with the Pearl Baking Company because they finally realized that that was not a good representation for Black women. The mammy was considered to be content to be a slave. So a mammy was loyal, always smiling, tended to be overweight, loved the white family, and was desexualized. Then we have the sapphire. And, when I was younger, I used to watch Sanford and Son all the time. I don't know who else used to watch that, but Esther on there was a classic example of the sapphire. And the sapphire was rude and loud and emasculating. And it was used to encourage Black women to be passive and to be seen but not heard. And this is a direct correlation with the angry Black woman stereotype today. And so that stereotype sometimes makes Black women not speak up because of the, fear of being stereotyped as an angry Black woman. And then I'll share the Jezebel. And the Jezebel, this stereotype was that Black women were hypersexual, worldly, promiscuous, And that also translates into how we have thought about Black women, especially in OBGYN. And more recently, this is a study that was published in 2016, and they surveyed undergraduate students, and they, wanted to know their thoughts about Black women versus white women. And they thought that they were more likely to have multiple sex partners in the last month, less likely to use birth control, more likely to be on public assistance, have less education, less income, less likely to be compliant with doctors' instructions, and less likely for the father of the child to be involved. And I would argue that these sentiments persist, even today, persist over time, and they're rooted in the culture of the country. So structural racism is the totality of ways in which society fosters racial discrimination through mutually reinforcing systems such as housing, education, media, employment, and healthcare. And this transcends our individual biases and prejudices, and is rooted in the institutions of the country. This is a great depiction of how structural racism can lead to maternal mortality. And so you have on the left the institutional practices, you have individual biases, and then the social and economic factors that come into play, like education and income, your access to care. Then psychosocial stressors, which are really hard to quantify, but the experiences of racism that occur over the lifetime. And it actually leads to something called the weathering hypothesis, which is where after repeated exposure to incidences of racism, that it just wears on the physical body. And then you have the physical environment where you need safe housing. Are there environmental hazards, like is the water clean? Are there places to get physical activity, like can you go to the park? Are there green spaces? Is it safe to walk outside or exercise? Um, and then we have the accelerated aging, like I already mentioned, and that compounds with chronic conditions like diabetes, cardiovascular disease, and asthma. And so then that leads to severe maternal morbidity. And so that can be anything from cardiac events or preeclampsia, which is high blood pressure during pregnancy, diabetes during pregnancy, obesity, risk of blood clots during pregnancy. And all of those things can lead to maternal mortality. For Black women, the number one cause of death is cardiovascular disease. So we can't talk about structural racism without talking about redlining. And redlining happened a few decades ago during the New Deal era, and it was adopted by the Federal Housing Agency and the VA department. And what it was the historical practice of grading neighborhoods. And so if you were in a Black section of the neighborhood or where other people of color were, and low income, then that was considered as hazardous and financially risky. The white neighborhoods were quote unquote safe and best bet for mortgage lending. And so they drew out maps. And so the hazardous neighborhoods were colored red and the best neighborhoods were colored green. And so those green neighborhoods over time continue to have economic investment into them, whereas the red neighborhoods did not. And so this is a map from 1937 of what Charlotte looked like. And as people who are from Charlotte would expect, Myers Park and Dilworth were green, and then you have other places like First Ward being red. And so over time, some of these areas have turned green because of gentrification, but historically, Myers Park and Dilworth were the green areas. So what can we do to start thinking about prevention? And so one of the things that we can do is increase healthcare access. And so thankfully, North Carolina finally expanded Medicaid. They were a little bit late to the party, but they finally did it. And they also extended Medicaid coverage for a year postpartum. The other thing is preconception counseling. So not a lot of people know that preconception counseling is available. So women who have, pre-existing conditions or had a hard pregnancy before, it's important to speak with like a maternal fetal medicine specialist or even your OBGYN to talk about risk associated with pregnancy and how you can optimize your pregnancy. And then integrated care for high-risk pregnancy. So one example of that is cardiac clinic. So we have a maternal cardiac clinic at Atrium that's headed up by Dr. Calicia Brown, and she coordinates with a congenital heart disease specialist as well as adult cardiology to coordinate care for these women because these pregnancies are the highest of high risk. Also things like telemedicine because rural maternal morbidity and mortality. I didn't really talk about that tonight, but that's also an issue. And there's issues with access to care from being so far away from hospitals. One of the really important things is maternal mental health care. As I mentioned, suicide is one of the leading causes of maternal mortality. And so making sure that women get connected during pregnancy to any resources that they need, as well as postpartum in particular. We have neglected, in the history of OBGYN, we've neglected the postpartum period. And so that's what the fourth trimester care is. And then doula care and access to midwife care. Our other speaker will talk about doula care. And then, of course, investments in social determinants of health, and then provider education about implicit bias and things that we can do on an individual level. And then what's really important is to think about diversifying the perinatal workforce. So of the doctors in the country, about 5% are African American. And so just developing pipelines. Atrium is working with communities in Charlotte to work on pipelines, especially with the medical school coming into Charlotte, Wake Forest Medical School coming next year. The other things that we do are looking at quality of care. So the Joint Commission is a national organization that looks at quality in hospitals. And one of them is severe obstetric complications, which is a relatively new thing that we're looking at this year nationally, and also looking at it by race and ethnicity. And then we have state collaboratives where we work with the state of North Carolina, and each year there's a different initiative on quality. And so this year is sepsis. As I mentioned, the first woman that I talked about, she died from sepsis. And sepsis doesn't happen very often in pregnancy, but we want to make sure we identify it early if it is happening. So looking at quality of care is important for all women, and so that will help eliminate some disparity. But again, the disparity is multifaceted. Quality of care is super important, but we also have to look at structural racism factors that can lead to disparities. There are national initiatives, and so Alma Adams is our congresswoman in the U.S. Representatives, and she sponsored Black Maternal Health Momnibus, which is a very comprehensive legislation that's looking to provide funding for things like increasing diversity of the workforce. Research initiatives is very, very broad. And so she has spent a lot of her time trying to improve the health of Black women. I'll end with this woman. Her name is Kira Johnson, and she was a pilot. She spoke 5 languages. She was an avid skydiver. She had gone in with her second delivery. She was having a repeat C-section, and she underwent surgery, and then after surgery, she had a hemorrhage, and that hemorrhage went unmanaged for several hours. And then when she went back to the operating room, finally, she had a significant amount of bleeding in her abdomen, and she ended up dying in the OR. This is her husband, Charles Johnson, and he became a strong advocate after the passing of his wife, and you see him with his 2 sons. He's done a lot of work with Alma Adams to pass the Momnibus Act. They're from California, and there's a specific state Momnibus Act that was passed in California in 2022. And then he also has a website called For Care for Moms, And on that website, you can buy this book for children who may have lost a mom during childbirth. So I always like to and just to remember that these are real women that are dying from pregnancy-related causes. This is just a snapshot of some of the women who have died. We review all cases in Atrium of maternal death, and thankfully that is a rare occurrence. But whenever we do that, we always take a moment of silence beforehand just to remember that these women are real people and that their deaths have, it extends into their families, their friends, their communities. And so this is certainly something that's dear to my heart, to make sure that we are doing the best that we can to close the gap in the disparity with maternal health. So with that, I'll end, and I appreciate your attention.
Thank you so much, Dr. Connors. Just a reminder that if you have any questions, please put them in the Q&A and we will answer them at the end of the presentation. Next up, I want to introduce our second panelist, Mrs. Gammon. Mrs. Gammon is a professional neuromuscular therapist and doula. Mrs. Gammon's company, Mother Radiance, is dedicated to supporting mothers through their pregnancy journey. She specializes in pregnancy and postpartum care, providing a vital service that can transform the pregnancy experience into a positive and empowering one. She focuses on reducing Black maternal mortality, which is particularly important, addressing a critical gap in healthcare. By offering holistic and intuitive care, her company not only aids in alleviating physical discomfort, but also provides the emotional and educational support that can make a significant difference in the lives of mothers and their babies. She prioritizes providing compassionate care and having a profound impact on the well-being of families. And with that, I will turn it over to Mrs. Gammon. Mrs. Gammon, you're on mute.
All right, sorry. Is it still echoing?
It is, yes.
How about now? Is there an echo?
I think you're good now.
Okay. All right. So Dr. Connors touched on a lot of points that I am going to bring up today, but I'm very passionate about Black maternal health disparities, and I believe that this is a topic that is not spoken enough about, and I'm glad that we're able to speak about it today. I just want to introduce myself. I'm Kaffia Radiance. I'm a neuromuscular massage therapist, and I'm a doula. I'm also a wife and mother of two beautiful Black boys, and I experienced major racism and care disparities during the birth and pregnancy of my second son, Sage. And I'll just share my story a little bit. From the beginning of my pregnancy, I knew something was off. The doctor who provided care for me, I feel like she really didn't see who I was, and she would suggest things that were not aligned with my holistic personality. And in the beginning, I just kind of let it go. But one random Saturday, I got a call from her after coming to her, letting her know I was pregnant, and we did the testing at the hospital. I got a call from her, and she just said, "Your pregnancy is not a viable pregnancy, and we're going to schedule the removal of your fetus." And I was so distraught. I couldn't believe it. I told her I felt like the baby was there. I wasn't experiencing any bleeding. She was like, well, I believe this is an ectopic pregnancy based on your HCG levels, and I'm scheduling you for removal. And I begged and pleaded with her to reconsider. And so she said, well, I'll allow you to go to the urgent care in Pineville, and they will let me know if the baby is even in the sac. And if the baby is in the sac, we can go from there. When I arrived at the location, they were disturbed because not only was the baby in the sac, but he had a heartbeat and he was older than they said that he was. And so from the beginning, I kind of felt off, and I knew that I needed to find a provider who would actually see me, who would actually consider me, and who would actually make decisions based on actual evidence-based facts rather than just bias. And then when I went, after my water broke having my son, just to fast forward the story, I ended up going to the hospital where that doctor delivered, and she was the doctor that was on call that day. Now, I had already switched my doctor to a Black doctor who I loved, and I felt like she really understood me, but she was also pregnant, and she was not available the day that I went into labor. And so that same doctor came up to me because, like many other Black women, I was experiencing preeclampsia. My blood pressure was in the 200s. And the room was spinning, everything was going crazy. I had no idea what was going on. All I know is they said that they needed to take me to the OR immediately. And as that is happening, my former doctor comes up to me and whispers into my ear, "You are not a good candidate for pregnancy." And that tore me up. I couldn't even focus on what was going on because I'm like, why would you say that to me? I want to have more children. This is just not the time. Even after that, I experienced more racial bias and more disparities in care when I had my C-section, which I had my second C-section in less than 18 months. I was denied any pain medicine. And I was in so much pain that my blood pressure would not go down. I was also experiencing something called PUPS, where there was hives covered all over my body. And she even refused to give me Benadryl because she thought that I was pain medicine seeking. And it was the worst experience that I could ever experience. I was in so much pain. I was so distraught. It wasn't until my mother got there and acted as my doula and got everything in order. She had the charge notes come down. She had the doctor come down, and everybody came to my room to speak to me. And I remember the doctor saying that she didn't believe that this kind of thing happened in her hospital. And she felt so bad for me. And she heard that this happened to Black women, but she didn't know her nurses provided this care to Black women. And it didn't stop there. I tried to get my placenta. The lab did not want me to get my placenta. They said if I wanted to get my placenta, I had to get up out of the hospital bed after having a C-section and walk down to the lab with my ID to give them my identifications in order to receive my placenta that day, or they were going to go forward without giving it to me. And this was very heartbreaking. And because of this, I decided to become a doula to make sure that other women do not experience these same disparities. And I am not alone. Black mothers, as we discussed, are dying. Black women are 3.5 more times likely to experience complications and death during pregnancy and birth than any other demographic. And the CDC says that these mortality rates are continuing to rise. Since 2019 up to 2021, the rates have almost doubled. And it's silly because we have so many advances in technology and we have so much access to the internet. It's almost silly that we are dying. And these are some of the reasons that I believe why. Poor quality of care, racism and unconscious bias, lack of education, cardiovascular related conditions, and lack of supportive resources for the Black family. One of the number one reasons that I feel that Black women experience what we go through is because of that large myth that Black bodies don't feel pain. And believe it or not, this is the belief of many healthcare professionals due to the systemic racism and generational myths that they have come to know. We experience poor quality of care because Black women are often ignored by health professionals, even at times of crisis. Like I told you in my story, my whole body was in hives and I was crying. I was like, please, I need some type of relief. And I didn't even mention, I have a background in healthcare. I completed an LPN program when I was in high school. So I have a lot of knowledge about healthcare, and more than most mothers. And I was letting her know, I said, I need some Benadryl because I know that this is PUPS, and I know that this is something that could be relieved with Benadryl. She refused to give it to me. And it wasn't until the next day that I received Benadryl. Serena Williams is a really good example of this. Serena Williams is a well-known athlete. She's an affluent Black woman, and she almost died during her delivery. And she believes that she experienced extreme racism and racial bias during her birth. None of the healthcare professionals around her acknowledged her cries for help. And at one point, her nurse even said that she was crazy when she was telling them that she believed that she was experiencing a pulmonary embolism. Ultimately, she diagnosed herself, and after extreme persistence, she was able to save her own life. But a lot of women are not as fortunate. And I put this quote up because I believe this describes Black women's thoughts about the healthcare system. We don't expect charity. We just expect the trust and dignity to which the white person is entitled to in this world by default. And I believe that a lot of women, we're not looking for an extra, a lot of times they believe that we're looking for special treatment, or we may be being dramatic, but we're just looking for the standard care. We're looking for unbiased care. And I believe that a lot of women experience racism and unconscious bias. And I believe that it started with slavery, because during slavery, slave owners had complete autonomy over Black women's childbearing and their bodies. They had no say in when they can give birth. They had no say in how they could give birth. Oftentimes it was not relieved with pain medicine or any other remedy that could be used whenever they went through extreme crises in birth. And that affects our healthcare system to this day. We're also used as test subjects a lot of times, and we can see that with the instances of Henrietta Lack, where they used her cells without letting her family know, and also the Tuskegee experiments, where they injected Black people with terrible disease and did not let them know. Black patients are often considered as learning material rather than patients with the right to healthcare and dignity. Sometimes I feel like when you go into the hospital, they don't really see you. Sometimes they won't even knock on the door because they won't even give you those basic human rights because they don't believe that you deserve them. And I feel like another thing that's really killing us are the myths. There are many racist myths about Black bodies that threaten the quality care for Black mothers. And healthcare professionals are often trained in segregated environments, which creates unconscious bias towards Black people. I believe that Black mothers are also in a compassionless and insensitive healthcare system, and birth requires compassion. And a lot of healthcare professionals are often trained to focus on the process of birth and not the birthing person. So oftentimes they're just trying to get that baby there the safest way they know how. And sometimes that removes women's basic human rights. They will do checks on women without asking them if they want it. They will not ask them for anything. They will just come in and do what they believe that they need to do. And they won't listen to the woman's cries for help or any of her suggestions about her own body. And a lot of doctors and nurses are experiencing compassion and fatigue burnout. They see a lot of these cases every day. Sometimes they go through traumatic experiences, and it kind of dulls them when it comes to being compassionate and sensitive when it comes to dealing with births. And this is something that the healthcare system really needs to work on, because doctors need assistance too. Nurses need mental health care assistance as well when it comes to getting people earthside. They experience a lot, they see a lot, they have to do a lot, and life is such a delicate thing that sometimes you have to become a robot just to make sure that everything is done safely. And also, I believe that cardiovascular related disorders are, not even that I believe, that is a fact. Cardiovascular related disorders are one of the #1 killers of Black mothers. Stress is a major risk factor for cardiovascular disorders in Black women, and epigenetic studies are proving that stress overload from environmental factors can be passed down through generations. So, like myself, I have preeclampsia. My mother had preeclampsia. My grandmother had preeclampsia. And epigenetics is showing that this could even stem from slavery because of what we went through in slavery and what we went through in segregation, and what our ancestors went through is embedded in our DNA. And we have stress on us that we don't even know about because it's ancestral stress and it is causing a strain on our hearts. Preeclampsia is among the leading cause of death in Black mothers. And oftentimes, like Dr. Connors said, these deaths were prevented with early care and with the proper resources. And Black families are experiencing a lack of supportive resources. Black families often lack the resources that assist in ensuring a safe birth for mother and baby. And that's because you don't know what you don't know. These are what I believe are some of the necessary birth resources to allow Black mothers to live. A culturally sensitive practice. Mothers need access to culturally sensitive care, like Black healthcare professionals and white healthcare professionals who actually are sensitive to the culture of Black people. I've heard stories of people being judged immediately because they wear their hair scarves. I felt like maybe me and my husband were judged immediately because we have locks. And if you are culturally sensitive, then you can kind of erase some of those bias and myths that are plaguing Black people. Another necessary birth resource is a doula, which I am. A doula is a birth worker. I know a lot of people don't know that term. It's newer, and a lot of people are becoming more and more educated on what a doula is. And a doula, to sum it up, is an advocate, someone who advocates for the mother to have the best birth that they can have, and that the best birth that they want to have. And doulas oftentimes speak up in the hospital for the mother when you can't, because birth is such a vulnerable process that when you're in there, you can be a doctor, you can be a lawyer, you can be the biggest person in the world, but that situation often dociles women, and they tend to allow things to happen that they wouldn't normally allow to happen because they just want their baby to get here safely. And so a lot of times the doula comes in, acts as an advocate, make sure that you are informed, make sure that you are aware of all evidence-based information, and that you know what you need to have in order to ensure your baby's birth and that your life is safe. Doula-assisted mothers were 4 times less likely to have a low birth weight baby and 2 times less likely to experience a birth complication involving themselves or their baby, and significantly more likely to initiate breastfeeding. I also believe that massage therapy is a very necessary birth resource, and this is something I'm working very hard on informing people about the importance of massage. Massage for prenatal and postpartum can do so many things. Massage decreases pain for mothers. They allow the blood to flow into the baby and into the mother. They allow the body to make space for that baby. And they allow you to think better so that you can experience a better postpartum. Mothers who receive massage therapy reported decreased pain, decreased depression, anxiety, and experienced better postpartum outcomes as a whole. Another important resource, I believe, is lactation consultants. Black women often do not breastfeed. Black mothers have the lowest breastfeeding rates when compared to white mothers. And this can be improved with breastfeeding education and coaching. And a lot of times in the Black community, families actually discourage people from breastfeeding. And I believe that's because of lack of knowledge. People really don't know the benefits of breastfeeding. And we also have to look back at a time where we were forced to breastfeed other people's babies. And a lot of that goes back to the epigenetics, where it's in your DNA to kind of have an aversion to something, even if you don't know about it. So it's important for women to have access to lactation consultants. And it's important for them to know all their options when it comes to feeding their baby, because we've learned that breast milk is the best milk for babies to get. It improves so much. It helps it improves their immune system. It improves their health outcomes. There's so many benefits to breastfeeding. Other helpful resources I feel like are mental health specialists, especially postpartum. Postpartum depression is a major killer of Black mothers. Like Dr. Connors said, there's a lot of suicides when it comes to the postpartum stage because we just don't know where to go. We just don't know who to talk to. We just don't know what our bodies is experiencing. And we need to talk to each other more about these resources. I just want to say that Black people deserve safe births, and I believe that it's very, very important for us to continue this conversation and talk more about it and educate each other as much as we can. The Black community is really good at sharing news when it's when they believe that it's interesting. And I would love to find more ways to make it interesting to learn how to save Black moms. This is something that shouldn't stop here. I hope that everybody shares this information with the next person, and so that we learn more about doula care, and so that we learn more about birth workers and massage therapy and mental health specialists, and that we can have a network of other Black professional healthcare workers that are sensitive to Black mothers. And I want to thank you. My name is Kaffia Gammon. Like I said, I'm a neuromuscular massage therapist and doula. My company is Mother Radiance Professional Massage and Birth Services, and I'm located in Gaston County. And Black people deserve safe births too.
Thank you so much for sharing your story, Ms. Gammon. Now we're going to move on to the Q&A. The first question is, I want to confirm something stated at the onset. Are Black women still dying more than whites in pregnancy related to issues, and this number has this number not changed since 1915 or 1950?
I can answer that. I didn't give that statistic. I think Linda gave that statistic, but the disparity in maternal mortality has been throughout the history of the country. I think that we're just being more educated about it recently, and I think that was really sparked by George Floyd and his death. And so that really helped people to start focusing on what is happening racially in the country in this day. And so since then, we've had a lot of attention on maternal disparities that we really didn't talk about before. When I was in medical school, that never came up. We historically have been taught a race-based medicine. So one example I'll give is something called the GFR, which is how the kidneys function. And in that calculation, it's a calculation that the lab does. And in that calculation, historically, they use race as a factor in calculating your kidney function. And in doing that, and the premise was that Black people have more muscle mass. And so that, obviously is not correct. And so by removing that, and that happened in the last, few years, by removing that, and even Atrium removed it maybe a year or two ago. But when that was removed, Black people that had been monitored for kidney disease, all of a sudden they were eligible for transplant because that race factor was removed from the calculation. And so Atrium went back and looked at all of those patients and moved them up on the transplant list to where they should have been had not race been in there. And in particular with moms, there's also something called the Grotman calculator, where it is used to, if someone has a history of a C-section and she's interested in a vaginal birth after a C-section, then there's a calculator that can calculate your probability of success when counseling that patient. So it depends on why the first C-section happened, but also previously race was in there. And so Black women and Hispanic women were considered to have a lower success rate for vaginal delivery after C-section just because of race. So all of these disparities date back into slavery, is not anything new. So it really hasn't changed over the last few decades.
Thank you. The next question, is there a higher rate of Black women being told their delivery requires a C-section?
Yes. I think we both agree with that.
Yeah, I was who was gonna say it first?
Yeah, there's just that is known nationally that there's a disparity between Black and white women and the rate of C-section. And that's also data that is being looked at nationally. And, I already mentioned that we just started focusing on these disparities really in the last few years. And so it's really only in the last few years, too, that data is being collected by race and ethnicity down to institutional levels. So we have national data, but institutional levels are lagging. But yeah, it's certainly true that there's a difference in C-section rates between Black and white women.
Thank you. Next question. Does a village help or hinder breastfeeding and PPD in our community due to judgment?
Absolutely. I believe I've heard many times that Black women are being discouraged by their village to not breastfeed. I've even heard a mother tell her child that that's what poor people do. Poor people breastfeed. Because if you're working, you don't have time to be at home breastfeeding your child. It's a lot of, I don't want to say ignorance, but there's a lot of myths also within the Black community about breastfeeding. And it's not encouraged enough. I've even heard that that's what white people do, which is completely not true. If we go back to slavery days when Black women had to nurse white babies because white women didn't. And so I feel like, yes, there is a lot of village reform when it comes to breastfeeding that is not spoken about enough. And it's just the need for more access. There needs to be more access to lactation consultants that you can relate to. Because a lot of times, if there is a lactation consultant who doesn't really understand your culture or who doesn't really understand your background, and they are giving you information and you don't know how to relay it to your family, like, this is why I'm trying to breastfeed, then you don't really get as much progress as you would like.
Thank you. Next question. Can you share or explain what a birth plan is?
I can. It's a big part of being a doula is having a birth plan. And a birth plan, it's important to say from the beginning, a birth plan is basically a birth suggestion. Typically, birth plans do not go exactly how you plan them, but a birth plan is where you literally plan out your labor from start to finish. You can put on your birth plan what you want to have in the room. You can put on a birth plan what you want to refuse. You can put on a birth plan what you want. As far as if you do have to have a C-section, you can make a birth plan for an emergency C-section. And a birth plan is just so that when you go into that hospital, you're able to speak up for yourself. You're able to let people know what your needs and your wants are. And they may not be followed to the T, but at least people have a suggestion when you can't speak up for yourself, because when you're in labor, you're not worried about a birth plan. You're worried about how to get that baby here. So it's important to make your birth plan early, but it's important to make sure that your village or your tribe, everyone has that birth plan so they can share it with the provider.
Yeah, I'll just add that I agree with that. I think Kaffia makes some really good points about how hard it is to advocate for yourself as a patient, whether you're in childbirth or even in other situations is hard, and it really doesn't matter what your background is. I would say that birth plans are encouraged, and I would encourage women to share those with your provider during your prenatal course. And sometimes that's hard because you see multiple people throughout prenatal care, but still, I think it's really important to share that ahead of time. So you can get feedback both ways about what you would like your birth experience to be.
The next question is, what are the steps necessary to become a doula here in North Carolina?
To become a doula in North Carolina, and it's not specifically based to your state. I will say that you can become a doula. You can become a doula in North Carolina. And you can also doula for somebody in California. But it's all about being certified. You can become certified as a birth doula and as a postpartum doula. There are many organizations that are certified, so it's important to make sure that you are certified through an accredited my brain is to an accredited practice, because if not, you may not be able to get paid through insurance. Some hospitals may not respect you when you get to the hospital, because like I said, doula care is new. Even the word doula is new. I remember I said it to Gerald, he had no idea what a doula was. And it's important that you make sure that you are joining a practice that actually is culturally sensitive to Black people. And that was a big thing for me. I really wanted to find a doula trainer who was either Black or spoke about Black bodies, because that is very important. There are many white doulas. There are Black doulas, but we're just now up and coming in this new craze. But it's important that you pick a culturally sensitive trainer. And you can do this by going online. You can do Dona is a great doula trainer. There's a National Black Doula Association is another great resource. And if you go on those sites, they can give you accredited classes that are near you, and you can take them virtually or in person. I always suggest in person, because when you're practicing the labor positions, it's really nice to do them yourself and not just to read about them or do it online.
Thank you. Next question. Given the information presented and the importance of birth, doulas and birthing advocates for African American women, is there a birth doula registry?
Yes, there are actually many. There are some that are nationally recognized, and there are some in your hometown. And I always suggest to get on a national doula registry. Like I said, DONA and National Black Doula Association, they both have registries that doulas can register with, and that you can go on and find a doula.
How does massages work during and after pregnancy for good pregnancy outcome?
This is my favorite topic. Massage is so important. During pregnancy, it helps to make room and space for the baby. It also allows the blood to flow to the brain so you can think better. Because during pregnancy, everything is spreading because of relaxing. And even your skull spreads. And that's why some cultures even wrap the head after pregnancy to put the things back together. And so when you get massage, it allows that blood to flow so you can think a lot better and you can move a lot better. And it allows for no birth is relaxing, but it allows for a better birth. I've even induced some women, and I've also performed labor massage. And it makes a huge difference when you're getting massage during labor, because it takes your mind off of that pain that you're feeling and it places it somewhere else. So oftentimes massage therapists will massage during contractions so that the mother can think about something else, so she can feel something else. And then after the contraction, we stop and allow the mother to get back into her body, and then you massage again during the contractions. And that is so that the mother can get out of her body so that she can bring her baby to life. Also, postpartum, incredible. It's the best time to get a massage. If you had a baby before, you know that after you have that baby, your mind is all over the place. You don't know how to feel about yourself. You look in the mirror, oftentimes, you don't even know who you are. You don't even know how to feel about the baby, how to feel about yourself. And oftentimes when you get a massage, it brings you back to your body. Even if you're not pregnant, if you get a massage, sometimes you're like, oh, I didn't even know that hurt. I didn't even know that this was an issue. So when you get a massage, it takes you back to your body. You feel like yourself again, even if it's just for a brief moment. And this is why you see better postpartum outcomes for women who receive massage, because they can think better and they can move better. You're in a lot of pain after having that baby, especially women who don't have hips to carry babies. Well, everybody's made to carry a baby in their own way, but sometimes that's hard if you have a 10-pound baby and you're only 120 pounds and you're carrying this baby all this time. Your body's in a lot of pain. And a lot of people underestimate massage because they believe it's for anniversaries or holidays or when you just want to feel good. But it's actually something that's very necessary for you to move your body and think. And when you get those muscles under submission, is like what I like to say, and you can get them to move the way you want to move, then you think better. And when you think better, the blood flows better. You go outside and you talk to somebody and you're a lot nicer than them, and you've made the world a better place just by making sure you took care of yourself and getting that massage and getting that blood flowing to your body.
Thank you. Next question. When the mother dies as a result of birthing, does the baby survive?
So I'll take that one. I'll say that most of the time the baby does survive. Most of the time, over half of maternal deaths are in the postpartum period. So of course the mom has delivered at that point. There are some things that happen, during labor. Sometimes some catastrophic thing can happen where both the mom and the baby can die. But most of the time the baby survives and the mom just is so sick that she ends up dying.
Okay, and I don't see any other questions.
I got a couple since I'm sitting up here on the panel and they don't let me come in through Q&A to ask questions, so I got to be live to ask these questions. But the one and I got a couple, but one is when I look at the data and the statistics about all of this, then the one thing that keeps crossing my mind is there are a lot of poor white people. And I'm trying to figure out, are these people calculated in the data that we are seeing, or they just miss some kind of way? Because I'm trying to figure out, this is really a serious problem if they are included and the data is still like it is with Black women going to the rate that they're receiving healthcare and dying and all of this. So help me understand the racial aspect of this with poor white people.
The data does include poor white people. So even a college educated Black woman has a 60% higher chance of dying during pregnancy or after than a high school educated white woman. And so I would say that if you look at disparities between white rural and white more affluent women, then there's probably going to be a disparity there. But even still, Black women are dying at a higher rate than poor white women.
I would also like to say, this is something that was shown with Serena Williams, and it came out a lot because they were like, this woman has money. This woman is famous around the world, and she was ignored. And so that's when I feel like they really started bringing up the fact that when you can compare this data to white women with no education, with no money in their background, and you can compare it to these Black women who are affluent and would be way overqualified for them at any job, and you're comparing these and you're seeing that Black women are just not cared for because of their race. There's nothing else. There's no other topic outside of just them being Black women and just experiencing extreme racism and bias.
And can a doula go with a pregnant woman from the beginning of the pregnancy all the way through to the hospital and be there with her throughout the pregnancy?
Absolutely. People start getting doula care sometimes often before they are even pregnant, because it is very important to have that partner. And some people get doulas because they don't have a partner. So it's very important for them to have that advocate and that partner that will help them navigate their pregnancy journey. And people do it from preconception all the way to postpartum, which they call the 4th trimester, and sometimes even beyond. Actually, postpartum doulas are way more in demand than birth doulas, and that's because we see a lot of these issues happen after birth. And so, if you have a postpartum doula, you can be you have a more successful chance of not developing postpartum depression, as well as some of these instances where women are having health conditions. They can be noticed by a well-trained doula, and they can alert a health professional or the midwife.
There's a couple other questions that came in. Can massages immediately after birth result in negative outcomes if the mom has internal bleeding that she doesn't know about?
That is a very, very good question. Absolutely, because massage is all about blood flow, and so it increases blood flow. And so it's important to speak with your doctor before you get a massage after pregnancy to just make sure that you're in clear. We usually typically wait for mothers who have experienced complications during birth to speak to the healthcare professional, but we at least try to wait 4 to 6 weeks before you get a massage. And that's if you have a vaginal birth. If you had a C-section, we try to wait till 6 weeks after your birth. And so we hope that in that time that if you are experiencing any postpartum complications, they would have been caught at your postpartum doctor appointments. But it's very important that you speak with your healthcare professional before you get a massage after birth, especially if you experience complications.
Can you explain the difference between a midwife and a doula?
Yes. A midwife is she or he, but mostly she, acts almost like the doctor does when it comes to birth. And they typically do a lot of home births, but there are also midwives that work in practices and work in hospitals as well. But a midwife actually that midwife actually delivers the baby. Whereas a doula is just an assistant. We're birth assistants. We just assist the process. We do not do anything that's extremely medical. We don't even really take blood pressures, or we don't do any of the medical interventions that nurses or doctors or midwives do. Midwives have a little more flexibility with what they can do. A lot of times midwives are basically a doctor doula. They are somebody who can deliver birth, but they also provide you that same care that doulas do. And often midwives come with a doula, like a nurse.
This next question, I just want to say to everyone that both of the presenters' contact information is in the chat. I believe Linda put it in there. My daughter has a school project on this extremely important topic. She is only 13 and has boldly chosen to speak about this awareness. What resources do you have available, and would any of the panelists be open to being interviewed by her to enrich her perspectives and project?
Absolutely.
Yes.
Absolutely. To hear that children are talking about this, because they're the future generation. They are the future mothers. They're the future fathers. And so for them to know this information is very, very important. And I believe that you're on the right track. I'm so proud of you for speaking up, because it is not something that's not spoken enough. And the fact that the younger generation is working on preventing this, that is incredible. And I would definitely love to be interviewed.
Likewise.
The person responded, thank you. So I don't see any more questions.
I have a question for Dr. Connors. I just want to know if there is a network of culturally, if there's like a website or anywhere where you can find culturally sensitive practices like yourself or other doctors that believe the same way that you believe.
No, I mean, the resource for that, I don't think really exists right now. I think that what some of my patients do is they are seeking out Black doctors. And so you can do that on any hospital's website.
But as far as like a list or something, no, that's not available at this point. But that's a good idea.
Yeah, I was thinking that would be great to be able to like make sure that other clients get doctors like you. And like you said, I did the same thing. I wanted to find a culturally sensitive doctor, so I went onto the website and I found the doctor that I felt would match my needs.
Yeah.
And for the attendees, are you not able to see the contact information in the chat? I just want to make sure that it's there and you can see it. If it's not in there, you can just respond and we'll make sure you get.
Well, it will be included. We will be sending out the video of this conversation, and all of that will be included in the video as well.
Yes, I have reposted it again. Thank you to the panelists for this awesome presentation and informing our community and increasing awareness.
Job well done, ladies. Job well done.
Thank you so much.
We still got some more things. We still got some more things. Okay, was there, Ryan, do you have any other questions there at all? No? Yep. Yep. Do you all see the slide?
They only see the person respond. They can only see the donation information.
Okay, I'll repost it there. Can you see the slide now with the upcoming events for the Charlotte Post Foundation?
Yes.
Okay, all right. So once again, we'd like to thank all the attendees for coming out to learn about this great critical conversations that we have. And if you'd like to see more of those, please put it in the Q&A and we'll continue this conversation. So for the upcoming events, we'd like for you to save the date. The Charlotte Post Foundation has an annual golf tournament. It's tentatively scheduled right now for Friday, October the 3rd. This is how you can support us as well. It's with the Charlotte Post Foundation annual golf tournament.
October the 4th.
October the 4th, okay. And we have sponsorships available. We make it a weekend celebration. On that Saturday evening, we'll have our annual gala black tie event. It'll be held uptown at the Charlotte Hilton, and look for us for more information about that. We do have special rates that are available at the Hilton uptown. And so please contact us. We'd love to have you participate and share the information as well. And at this time, on behalf of the Charlotte Post Foundation, we'd like to thank each of you all for attending our webinar on Black maternal health. Thank you, and good night.
Okay.
Okay. Let's see, there's one other question there. Let's see. You want to have oh, they said they can see the information.
Okay.
Okay. And if necessary, you all can give us a call at the Charlotte Post, 704-376-0498. And we'd be glad to get you the detailed information if you had not, was not able to see it in the chat. Again, thank you. And this concludes our webinar for the evening.
Thank y'all so much for this experience. This was amazing.